Hi everyone, my name is Kathryn Higa. In case you hadn't noticed, I'm not Sam. I'm actually in Sam's office, in Senator Slom's office, as his Chief Policy Advisor. And while Sam is on vacation, actually, I think he's just waiting to watch and cackle at me doing one of these sessions. I have the great honor of having with me today two ladies who represent the YMCAs of the state of Hawaii and of our East Honolulu district. And they're here to talk to us today about what they do for our communities with a whole range of programs. I think many like you and myself are really surprised to find that they offer and that are so conveniently available to us. So ladies, I wonder if you could introduce yourselves and tell us all about what you do.
Aloha, I'm Diane Tabangay, and I, with the YMCA of Honolulu, I'm the director of the children's programs, so I help to provide resources and support for our children's programs from early learning all the way to teens that are actually providing community throughout Oahu, a total of 9 branches, including Camp Urban out in Mokuleia.
9 branches.
And I'm Erin Farmer.
Hi,
Thanks
Erin.
for having us. I'm the Chronic Disease Program Director for the YMCA of Honolulu. So similar to Diane, I work with all the branches and delivering programs for folks that are suffering from chronic diseases. So anything from arthritis to diabetes, stroke, things of that nature. So looking at developing new programs and bringing them to Oahu and rolling them out over the next 12 to 18 months.
That's wonderful. Diane, I wonder if you could tell us a little bit more about your children's programs.
Absolutely. So we run programs, like I mentioned earlier, for little keiki, so preschool age children all the way to teens. And with our guiding principle really is that children never stop learning. So when they're outside of the traditional classroom, it really is helpful for them to be in environments that support their learning, helps to continue their use of skills that will help them to do well in school. So I'll start with our youngest level. So we have a part-time preschool program at some of our branches, but the one that I'm most excited about is a family-child interactive program called Come With Me. And we do it in target populations, public housing, low-income families, new immigrant families. And the families that we serve are those who have chosen to keep their children at home rather than put them in preschool for whatever reason. Sometimes it's an economic decision, or sometimes it's just families' cultural belief that they prefer their child to be at home with someone that they know. So
Are there, excuse me just a moment, are there fees for these programs for these families?
We actually do some grant writing to secure funds. Our major sponsor is Aloha United Way, so we're able to provide this in communities and do the outreach and have the programs right in communities, right in public housing, or in the heart of Kalihi, for example, at no cost to the families.
That's great. About how many children do you think you serve with those programs today?
A total about 60 to 70 families. So with this program, Kathryn, the children come with their caregivers, and the caregivers are not always the parent. Most times it's a grandparent. Sometimes it's the father, it's the non-working parent, or it can be an extended family member or a neighbor or a friend that comes with the child for 2 hours twice a week. And we set up the environment in a play and learn learning center environment, and it's really the caregiver that's guided. We build the capacity of the caregiver to be the first teacher. So we facilitate the interaction that goes between the caregiver and the child.
That's great.
And each center focuses on a developmental area. So there's language, there's science, discovery, there's math, there's reading and literacy, etc.
So this is for preschool children up to age 5?
Yes, yes.
Okay, and then
the biggest piece of our youth development programs would be for the elementary age. We are one of the major providers for the DOE's A+ after school program. So currently we're in 54 schools. We also serve some independent schools, serving just under 7,000 children every day.
Fantastic.
Yeah. So we work in partnership with the schools that we're at to make sure that when the bell rings and the children are released, they have a safe place to be. We support them with homework help. We make sure that their time with us is enriching and meaningful. So we do a lot of sports skills, arts and crafts, reading to them, and we several years ago, we started a nutrition program called Food and Fun, where the children are learning about nutrition, healthy eating, and it's really hands-on curriculum, so they get to do a lot of snack preparation and taste
Oh,
testing.
good. You can send some over to my house.
It's
Teach them how to cook.
really fun. And the other thing we do for the school elementary age children is we're year-round, so our slogan is when school's out, why is not kind of thing. So we provide programs during the spring intersession, fall and winter intersession, and then we have our second biggest program is a summer day camp, where we have day camp programs at all of our branches, resident camp, audit camp, and
And again, these programs are there fees for participation?
yes, the branch programs during the intersession summer there is a fee to it. However, we have a strong commitment so that to every child. For every child to be able to access our programs. So we have every year an annual support campaign. So we build our financial assistance pot. So families who want to send their children who just can't make the fees are able to apply and get the support that they need.
That's great.
Yeah. And then we have teens. We have middle school teen programs and high school, and our focus there is on team building, being able to work collaboratively, leadership development. So there are a number of different programs that we do.
Something that caught my eye in the brochure that your team left behind last week was about youth in government. Can you tell us a little bit about that?
Yes, it's really a very educational piece, and it really helps our teens to develop their leadership and learn their civic responsibility, understand the legislative process. So they have officers, and they go through a whole mock duplicate of the real session.
They write bills.
Opening ceremony.
Yeah, that's excellent.
They do research on community needs.
So it's a mini legislative
Absolutely.
session.
They propose
Really
bills
cool.
and they go through the whole.
Maybe they could
whole
teach
process.
us too. Yeah. Do they stay on schedule and on deadline? That's something we could learn to do.
And we go all the way up to support teens who are transitioning from high school to hopefully postgraduates. We provide again, this is grant covered, what's it called? College camp, yes. So we give, teens who may not think attending college is something that they're able to do. They invite them to college camp, and they are exposed to a number of different experiences, and then begin to see that, maybe applying for college is something I can do, and we support them through that process as well.
They stay in the dorm for a week or weekend and get to pal around with some of the college students. So really neat
That's
exposure.
great.
Yeah.
Let's switch gears a little bit and talk to Erin about some of the programs that first reacquainted me with the Y almost 16 years ago now. I did not know that the Y offered programs for seniors.
Oh yeah, absolutely. Our membership base is about 15,000, and about 35% of those are seniors, so 65 and older. So we have numerous programs.
I'm getting close.
Are you a Y member yet? You can start now. Come on.
I'm going to have to think about that.
Yeah, it's for all ages really. So, but specifically for our older adults, our active older adults, we have plenty of programs, and as I mentioned before, with the chronic disease program. So folks who have Parkinson's disease, arthritis, stroke patients that all come into our different various programs.
So tell me about these programs. Do you have a teaching component? Are there actually trained and credentialed or certified professionals who work with them?
There are, absolutely, yeah. It's all the programs that go for our program filter have been research-based, they're evidence-based. So a lot of good data has come out of that and shown that everything from the social aspect to the emotional well-being and the physical well-being, the folks show improvement in all those areas. So yes, our trainers, our lifestyle coaches are all certified and trained from a national system from our YMCA of USA. So there's been, like I said, research on these programs. There's a training system in place for our staff. And the programs, it depends on what it is. So for example, our Parkinson's and arthritis, they're movement-based, so exercise-based kind of programs. Whereas our diabetes prevention program is actually like a classroom type setting. So
diet, nutrition.
Right, all that good stuff. So
all that good stuff.
Yeah. So specifically our YMCA diabetes prevention program, we're going to be rolling that out later this year. It's a year-long program. There's a 4-month kind of intensive weekly sessions, and then every other week you meet, and then monthly towards the end. But yeah, that's been on the mainland, and folks who have run the program just seen tremendous improvement in folks' health. The goals are to lose 5 to 7% of their body weight and increase their activity level to 150 minutes a week. So
that's great. You have an upcoming event on the 25th of May, I believe it is, at Kahala Mall.
We do. It is National Senior Health and Fitness Day, and the YMCA of Honolulu and Generations Magazine and Kahala Mall all got together to put on this fantastic event. It's going to be Wednesday, May 25th, 9 to 1 p.m. We have about 45 vendors coming, and we're giving away a trip to Vegas. So yeah, come on down. Come on down.
And a roll of quarters, maybe?
Yeah. Yeah, so it's going to be a lot of fun. We're going to have demos and healthy snacks. And
will you be doing those things like the blood pressure?
Absolutely. There's blood pressure checks. There's all kinds of goodies. So we hope folks come down and check it out.
Outstanding. Yeah. So one of the things that the Senator talks about every year, and one of the reasons I wanted to have you folks on board, is that there are often questions asked in our community about why the Senator seems to always vote no on programs that are related to, for example, before and after school care. And I was just talking to a group 2 days ago where I said, first of all, the Senator doesn't always do anything. There's a lot of thought given to what he votes on and how he votes, and the no votes especially. But he has had a tendency to say, and you may have heard Sam's speech, that across the state we really need to evaluate how we invest in programs for children before and after school, and increasingly for the elderly. Because there are good programs like yours that actually provide these services. One of the things I wanted to get back and ask you about was you were talking about A+, for example, and how you're affiliated with schools.
Yes.
I seem to remember my niece and nephews participating in A+, and they went to public schools. So how do you work together with the public education and other public health facilities when we switch over to Erin?
Yeah, so many people don't know or forget that the After School A+ program really is a DOE program. It's quite unique. It's recognized nationwide. Hawaii is, I think, the only state that has a DOE component that addresses the need to have a safe place for latchkey children whose parents are either at work, at school, and would go home otherwise to an empty home and be unsupervised. So it was started back in the 70s or late 70s. So every elementary school, every public elementary school actually is required to provide after-school A+ program. Many of the principals opt to contract their services out to organizations like the YMCA of Honolulu. So it's a really good example of how the Department of Education can work collaboratively in partnership with a private sector like the YMCA, because our site staff do work very closely with the school to make sure, for example, if they have a way of promoting appropriate behaviors, that the same method is transferred in the after-school hours, so that it's
there's consistency.
There's consistency,
yes.
Absolutely. And we get to utilize their facilities at no cost to us, so we're able to keep the rates down. And when there's a child that's struggling with a certain thing, we're able to talk with the teachers or talk with the counselors. So there's that really nice working together to make sure that the child's needs are taken care of after the bill brings it as well.
And Erin, how about you? How are the senior programs affiliated with our existing services and infrastructure?
So a lot of our members actually have their memberships covered by their insurances. So whether HMSA, Senior Advantage, or Kaiser, Silver and Fit, a lot of folks who have those services, the memberships and some of the programs are essentially paid for. But it's the bigger programs like the diabetes prevention program that we're working together with folks in the Senate and getting bills passed to get some of these programs covered. So the DPP is the hot one right now, diabetes prevention program, and getting Medicare to cover the costs, and really working collaboratively and together with you folks on getting that.
So that's one of the things that people should be aware of when they come to enroll in these programs. Do you have counselors who will work with them to find out which are covered under their preventive care plans and things like that?
Oh yeah, absolutely. Yeah, we have a whole menu of things. So a lot of times it's just a matter of, well, what's your insurance, and they can kind of go down and see, what's covered, and we just call them right there. There's online database we can help them look up, for seniors who aren't necessarily computer, internet friendly.
Of course.
So, yeah.
Do you teach computing classes at the Y?
We do not, but there is one, where was I just? Lanakila Senior Center does have one.
And the libraries.
And the libraries. So I've
Yes.
been sending some folks over there. Yeah.
So what else would you like our public to know, our viewers to know about programs that you offer?
Well, the YMCA of Honolulu is more than just a swim and gym, and we really want to get that message out there.
Although it was really helpful to me learning to swim.
Yeah.
My entire family remembers the deep
our
end of that pool.
Yeah.
But it's really a gathering place too. When you talk about seniors, if you go walk into any of our branches during the middle of the morning or middle of the day, it's really nice to see the seniors there gathering and socializing and just potlucking it. Just a place for them to come and then take advantage of the exercise classes or being able to go into the pool. It really is a gathering place in communities across the island. So families should come check us out. Yeah.
Yeah, and just to echo what Diane was saying, we are more than just a swim and gym. I know a lot of folks have memories of swim lessons growing up, right?
And somewhat traumatic in my case.
But really, we are very innovative in our programming now, and these programs that I'm specifically working on, they are evidence-based. There's, the CDC backs them, and they're really.
When you say evidence-based, that means that the educational component and the programs that you put together are all based on
they've been tested.
Existing medical
right. So
research.
National Institute of Health, CDC, put a lot of money and time and energy into making sure these programs are effective. So a lot of the medical community are starting to catch on too, and the Y really is setting up a nice clinic to community type model where we're able to run these very effective and impactful programs in a community like the Y.
So these are programs that people who come to the Y might hear of being offered at a hospital even on the mainland or through other healthcare services.
Correct, but there a lot of the medical providers and the insurance companies are really starting to catch on to these Y programs because it's the doctors and the medical care providers can only do so much one-on-one, right? So sending them to a community type program such as these really is great, and we're able to get back to the physicians and the providers on the data that we're collecting. So they really like to see that, and that's where the reimbursement is going to start to come through. So,
you said that about 30% of the people who use the Kaimuki-Waialae in our district are actually participating in these elder programs for programs for people my age. Actually, is there a waiting list? Does it take a long time to become enrolled in them?
No, actually, for our arthritis management program called Enhanced Fitness, we're getting ready to launch a new session in May. So folks can go on down right now and sign up and get enrolled. There is a little bit of paperwork and data collecting in the beginning, but essentially we can start them right then and there. Yeah.
So people who want to learn about these programs can go to your website. How would they find out about you? That's important.
Just go to our website, www.ymcaofhonolulu.org, or just give us a call.
What's
Diane's
phone
number is it's 531 YMCA. I think
Yes,
it's
absolutely.
9622.
9622.
Okay. Or they can just drive by and you have
sure.
people
Come on
who can
in.
work with them
Yes.
on finding programs that fit their schedules and their budgets
Absolutely.
and all that.
As soon as they walk into any of our facilities, there'll be a welcome center that they can stop by and ask all the questions to get the information that they want.
So any sneak previews on things we might see coming next year?
Well, we are going to be, as I mentioned, the YMCA Diabetes Prevention Program later this year, and then in 2017, a hypertension or blood pressure management, self-management program.
I need that.
So that will be coming in 2017. So very excited about that one as well.
Well, excellent.
Yeah.
I think that's probably a wrap for today, unless you ladies have something else that you'd like to ask me about.
No, I just want to say one pitch. If families have not made their summer plans for their Keiki and youth, we have our YMCA day camp information posted on our website, and they can start registering.
Yeah, it's getting to be that time, isn't it? In just a couple of weeks, start making plans for the summer.
Absolutely.
Yep.
Well, thank you very much for joining us. I'm sure we all learned. I did. I always do when I meet with you folks, and I hope everybody out there learned as much as I did this week working with them. So please go and visit their website, and you now know who to talk to. And hopefully we'll have even more of our community making use of these great services. Aloha, everyone. Have a great month.